Welcome back. Just as we plan to round off 2024, staying safe, staying healthy is very important. Checking on your vitals and your health, so important. But we have a guest in the house. She's going to tell us so much about health, about nursing, what we need to know. She's Professor Modupeola Aka Bashorun Adebayo. She's the founder and leader for the Yoruba Nurses of North America. Welcome to Breakfast in Bed, ma.
Thank you so much.
Great to have you, ma.
Compliments of the season.
And same to you.
How's America?
Well, America is good. Yeah, cold.
Cold, okay.
Yeah. I mean, it's that time of the year, but we thank God.
Glad to have you, ma.
Yes.
And let's get straight into it. What's the motive? What's it about Yoruba Nurses of North America? Because this, I guess this is Yoruba Nurses of Yoruba Indigen or Yoruba ethnicity coming together. So what is it about that group?
Okay. So, well, thank you for that question. Well, actually, of course, my background as a nurse is one of the reasons for Yoruba nurses. But more importantly, some of our exposure and training experience kind of propel us into wanting to give back to our community, at home. And also coupled with the fact that we know that access to primary health care is not as easy as it is over there where we live. I mean, in the US and in Canada, access to healthcare, primary healthcare is very, is abundantly so. And in comparison to that, we know that it's not like that here. And we started to kind of brainstorm what are some of the ways that we can bring some of those, our expertise, our experience, so that our people can also benefit from us being there. Yeah. Because, as Yorubas, we always say that kakeri ukodele. So, and it's also very important for our people to also benefit from what we have, achieved or have accomplished as healthcare providers in the U.S. So community nursing is something that is my passion. So I'll say that. Although during my training, I only had maybe a couple of months of rotation through the community, health centers, in Atlanta, because I trained at Georgia State University for my baccalaureate in nursing. But my experience as a bedside nurse was mainly in the hospital until I got into academia, which is academia, right? So in 2017, I transitioned from hospital practice to education. I started as clinical instructor at Georgia State University, and then moved on to clinical assistant professor at Georgia State University. But one of the courses that I taught then was community nursing, and that's where I found my passion. When I say I truly found my passion in community nursing, because then I realized that a lot of the sickness or alignment that brings people into the hospital could be prevented, and it's really through awareness. Just mere, educating people about, their lifestyle, their choices, and also, what we call modifiable factors, which means factors that people can do something about, right? That you can modify and prevent those conditions from happening to you. We know the non-modifiable ones, like your parents, your heritage, your genes, you can't do anything about it. Your age, your gender, you can't do anything about it. Like, for example, high blood pressure runs in both sides of my family, mother side, father side. So I was kind of aware of that. But what about individuals who are not aware? And then there are also choices that we make in life that will contribute to us developing that condition. Even though, if you're predisposed to it, because of your genes, right? You can still, prolong your getting that condition. And even when you get it, with early detection, you can actually manage it in such a way that you can live a normal life.
Now, I like,
and that's where I'm going to go.
Okay, yeah, because I like I love your profile.
Yeah.
So you've told us.
Very broad.
Yeah, very broad.
Yeah.
Now, a professor. With all this, you said creating awareness. How is that working for you in Nigeria?
Exactly. Thank you. So last year, we started with, we partnered with Obafemi Awolowo University, the nursing department there. We screened 3 communities in and around Ife for high blood pressure, high blood sugar, because those are the 2 common conditions that afflict our people. And more so, the complications of these conditions are very, they are huge in terms of cost and in terms of even human, human resources. Because if a person who develops stroke from high blood pressure, poorly managed or unmanaged high blood pressure, if they develop stroke, do you know what's going to happen to that person and their family? If that person is a breadwinner, you know what's going to happen to the people who are dependent on them. Then on top of that, it's going to cost money to take care of that individual. At least, the person, minimally, they will have at least 1 disability. 1, it may be more. And disability in terms of, they cannot, just basic things like grooming, self-care, caring for self. They will depend on other people to take care of them. The person who is going to care for them, their caregiver, may be a family member. It means that that person will need to, work with his or her time. You remember that if they have to go to work, they will need to, first of all, take care of that person before they go to work.
That's lots of mental health.
Exactly. So you see the implications, not just the cost. Now talk about the money for, seeing the doctors, buying your medication and doing all of the, traveling to your doctor's offices or to do tests and all of those. So those are the costs. What about the human implications of that? Because it disturbs other people, not just that person who is afflicted with a stroke, but the other people who are around them, including the children, because if that person is a breadwinner, the children suffers, right? Their education. You see how that impacts not just that family, but the community as well. So you see, one person's problem can become a community problem, and that's the goal of doing community nursing. While we all come together, we need to talk about this, then we need to talk about how we can prevent it, and then if it does happen, how we can help each other to pull each other up. And so as a community to kind of, win the battle.
So from all you've said now, so how do you intend to promote the cultural and social values with this initiative?
Okay. So, well, first of all, healthcare or patient care is culture specific. Yes. It's culture. So you really cannot take care of a person if you don't understand their culture. So I do know that in our culture, like we have food, we have, some activities that we engage in. Food, for example, we eat a lot of oil, right? So we want to talk about, our diet, we want to talk about that. A lot of salt so that our food can taste better. But there are ways like, something that you can substitute, for salt. You can use garlic, you can use onion, to kind of enhance the taste of your food without having to put a lot of salt in it. Because with salt, and I usually tell my students this, I say, where sodium goes, water follows, right? So yeah, and with that, with the huge amount of water that you have on board, your heart will need to work twice as hard to pump blood to all of the other organs in the body. So you're overworking your heart. Now, I said something to the young man before we started. I said, our heart loves us. We need to love it back. How do we love our heart back? We need to talk about, our diets. We need to talk about activities. Now, when we do go to parties, because that's our culture, right? We do a lot of parties. We're very happy people. That's fine. When we are in that environment, we tend to eat more than you normally will eat, because they will serve you all kinds of things, and even the portion will be large.
Well, these days, they're no longer large.
Okay, that's fine. Even small portion, but then it adds up, right? Just 2 days ago, we were at an event. They gave us, there were several servings of different kinds of, food items, those kinds of, but, we ended up eating more than we ordinarily will consume. All of those will also cause more, it can, overweight, obesity. It makes your heart work harder. But there's something you can do about it. You know what? While you're at that party, get up and dance. because dancing is a form of exercise, and it will help you to shed that excess food that you put in your body. You shed it out there, right there. So you don't have to take it home, and then and deal with the the hard work. So again, talking about we can actually use our culture, what we love most, to also control our lifestyle and our choices. So that way we can love our heart back, just like our heart loves us.
I like that. So now, what's been the reception from Nigerians?
Oh, it's been very warm welcome everywhere we went. Like we did, we screened people in 7 local governments. And in each of those local governments, people have been very, very receptive. Even their leaders as well. I don't want to get in trouble, but I think I will get in trouble with this one. There's actually one of our, leaders here who was very, very, he really helped us with the logistics and the plans and everything. Honorable Orekoya. Yeah, it was very, 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 very helpful. So he helped us, reached out to all of those local governments, the chairs and the medical officers there. So at Ibeju Lekki, we were in Ibeju Lekki on the 15th of December. Their medical people helped us as well. We also had our people, on ground. So we collaborated, we worked together, and were able to screen people for major conditions there. On Monday, which was December 16th, we were on Lagos Island. We worked with the Brazilian Descendant Association. They helped us to, and I'm also from that community as well, because I'm a Brazilian descendant. So we worked with that group. They facilitated, us, doing that screening in their community. That was on the 16th of December. On the 17th, we were in Igbobo, and the KBSC of Igbobo also was very, very supportive. And, they helped us in that community. So we were at Igbobo, we were at Italewa in Ikorodu that same day. Then the next day we were in Somolu.
Wow, so
Somolu local government
I
in
like
Bariga.
the fact that you have a long list of places that
Exactly, we were
so
in
that,
Somolu.
you got great reception.
They received us well. And then finally we were in Bariga. Then on Thursday we wrapped it up in Agege.
So, what are your plans for training initiatives for nursing?
Okay, good. Thank you, because I'm an educator as well. I'm not just a nurse, but I'm also an educator. And so that's my second passion. I don't even know which one, nursing. But I have several of them. So so the training really, last year we partnered with Obafemi Awolowo University. We had their nursing students. They came out to help us to screen. So that way the nurses in the community, they are oriented to what the conditions are of their people. So that way they can hit the ground running once they become, professional nurses. This year we worked with the LASUCOM, Lagos State University College of Medicine. The nursing students were with us all through this, the screenings in those 7 communities that I talked about. And the actual goal is to continue to engage nursing schools so that they can partake in this community nursing. One, for them to get a very good orientation of their community. That's one. Then secondly, to kind of, do a cross training, where we will actually be engaging them with training over there. And that's something else that I'm working on. Eventually, so to answer your question, eventually I'm looking at an exchange or a kind of, even if it's virtual exchange, but a study abroad for my students at Kennesaw State University. That's how yes. So our students from Kennesaw State to kind of have like a kind of exchange with students here, from different nursing schools. So that way, the end goal is we'll have a kind of a global perspective of caring for people, because diseases are not geographically bound. COVID didn't say, oh, this is America, I'm only going to afflict these people here, or this is Nigeria. It's a global thing. So training has to be global. So we need to liaise, globally, so that we can, together, address all of those conditions.
Wow. So we need to leave, but before we let you go, how long have you been in America? For you to come up with all this, the innovation, the plan, the group.
Very passionate.
How long? They're very passionate. How long have you been in America?
I've been in America for about 30 30 something, yeah.
Wow,
Over
great
30-something
deal. I
years,
like
yes.
that.
Yeah.
Wow, I like
so
that.
for 32 years, yes, about that. Yes.
Okay, so if I let you go, you know, the new year is next week, a few days. So what's your wish for Nigeria?
Oh.
As a Nigerian, we left 30-something years ago. Yeah, I know you usually come on, but you're
Yeah.
here
Oh,
again,
yeah.
and you're looking at Nigeria again in 2024.
I
I know, you know, that
Lagosians,
times you just say
right.
like, I wish. So what's just your wish for Nigeria before we let
Well,
you go?
it is a wish, but it's also a wish that will come true. For every single citizen of this country to have access to basic, and I just say basic care. And the basic care is just like being screened, I mean like routine screening to avoid, you know, conditions that can sap our, you know, resources like I explained earlier on. So well, collectively we'll do that. And so and it is my wish, and I'm trusting that God will make it, you know, a reality. That
Amen.
every single person will have access to basic care.
Thank you very much. So we've been speaking with Professor Modupeola Aka Bashorun Adebayo,
Yes.
the founder and leader for the Yoruba Nurses of North America. Thank you for coming to Breakfast in Bed, and well done on all you do for caring for people and making people feel healthier.
Thank you so
We
much.
really appreciate.
Thank you for having me.
You're welcome.
It's a pleasure.
So we'll go on a short break and we'll be right back.
I'll give you some breakfast in bed.